Welcome to a brand new state-of-the-art brain and mind care facility here in Chennai. Brain stimulation to psychological therapy, Ayurveda to yoga, cognitive stimulation to naturopathy, physical, occupational and speech therapy, we are the pioneers and innovators of integrative care for the brain and mind.
Welcome to Buddhi Clinic. Neuropsychiatry as a specialty is one that affects the brain and mind interface. And when we say brain, we know we have an organ there. But when we say mind, we touch our hearts, we touch our heads. The mind is really just the software in our brain, the millions of nerves talking to each other through chemicals. What do we have in our armamentarium to treat these patients? We have surgery for some, medication for many, if not most. But beyond all that, what do we have? And what we do have is rehabilitation, therapy, and care. Now, usually a person with a neuropsychiatric condition will have to go to various places in order to receive these treatments. Imagine if you could get all of them under one roof. Imagine if you could, just by traversing floors, meet experts in every one of these disciplines who are programmed, prepared, and equipped and qualified to help you. And that really is what we offer you here at Buddhi Clinic. The opportunity of blending modern science and ancient wisdom, the opportunity of being able to receive a very wide array of care treatments that can help you. So do come, visit, see what we have on offer, and I'm sure you will not be disappointed. In fact, I'm sure you'll feel exhilarated by what you see here. Thank you.
The basement houses the state-of-art neuromodulation facility. We have repetitive transcranial magnetic stimulation, transcranial electrical stimulation, which comprises of TDCS, TSES, pulsed and random noise stimulation. We have transauricular vagus nerve stimulation. Along with the neuromodulation, we have yoga and mindful suite, as well as the mind labs, where we are following the traditional as well as the modern way using the computerized models of assessment and therapy.
Welcome to the Neurodiagnostics lab. So this suite is well equipped to run all our electrophysiological assessments. So here we do the EEG, the nerve conduction studies. We also run the autonomic tests. And here you can see the tilt table, which is used to do part of the autonomic testing. This suite also has a state-of-the-art sleep lab. It's a very comfortable space where patients with sleep disorders have an overnight polysomnography, that is the sleep study. So you can see that this is a suite which is very well equipped to run all the neurodiagnostic tests for patients with neuropsychiatric disorders across the lifespan. Welcome to our advanced gym facility on the rehab floor. Here we have equipment which is customized to address physical disabilities for patients with Parkinson's disease, for stroke, for traumatic brain injuries and various other neurological disorders which cause a lot of distressing physical disabilities. These are our mobility lab suites, a part of the rehab floor. And here our well-trained and expert physical therapists deliver interventions such as electrotherapy, manual therapy and exercise therapy for patients with pain, balance and posture issues and autonomic symptoms among various other physical symptoms of neurological disorders. This is our Dr. Deepa Krishnan Neurodevelopmental Therapy Suite, and here our physical therapists work with children with neurodevelopmental delays. On the rehab floor, we have the speech and language therapy suite, where our speech and language pathologist delivers speech interventions and swallowing maneuvers to children, adults and elders with speech and swallowing disorders. The second floor is dedicated to holistic care. So we have the complementary and alternative medical treatments. So here we have 2 dry therapy suites where we do acupressure, reflexology and meridian massage. And here we have 3 wet therapy suites where we do treatments with medicated oils, powders, with foments, and we use mud packs, after which the patient can go across to the bathroom and have a bath. And these treatments are used for a host of physical, cognitive and behavioral symptoms which are very common in neuropsychiatric disorders.
Hello and welcome to this edition of our webinar under the Hindu Wellness presented by the Buddhi Clinic, Chennai. I apologize for that slight delay in the start of the program. Today, the topic we are going to discuss is autism and neurodiversity, unlocking human potential, which is certainly a matter of importance, which we all need to understand. Neurodiversity is a word which is used to explain the unique ways people's brains work. Everyone's brain develops similarly, and yet no 2 brains function the same way. Being neurodivergent means having a brain that works differently from the average. It embraces the idea that people experience and interact with the world around them in many different ways, and that there is no one right way of thinking, one right way of learning, or one right way of behaving. The differences are definitely not deficits. Autism, dyslexia, ADHD, they are perhaps at the core of neurodiversity spectrum. But as I was discussing backroom with our speaker, there are various other forms of neurodiversity, but often we fail to recognize them, and which can manifest and be identified at any stage of life. But as a society, we fail to create the right environment, perhaps, for the people to achieve their potential or make them comfortable enough to fit in. To talk on the subject, we have a very well-known behavioral neurologist and neuropsychiatrist, Dr. E.S. Krishnamurthy, who is the founder of Buddhi Clinic and Neurokrish. Welcome, sir.
Thank you.
A pioneer of integrated and holistic care and rehabilitation for the brain and mind, he has taken on multiple international leadership roles in the clinical sciences and treatment of epilepsy, dementia, and neuropsychiatric disorders. Dr. Krishnamurthy is the immediate past president of the International Neuropsychiatric Association and the editor of the Global Approach series for Cambridge University Press and Neuropsychiatry Across Cultures for Oxford University Press. He has to his credit 70 plus scientific papers, 30 plus book chapters, and over 25 articles in the lay press and has lectured widely across 4 continents. He convenes the T.S. Srinivasan Conclave and Oration annually. He is the adjunct professor at Manipal University and Public Health Foundation, India. He is also senior clinical advisor, neurosciences, to the Apollo Hospitals Group. So the floor is all yours, Doctor, to tell our audience about, like as you said, what, who, when, where, why, and the how of neurodiversity first.
Thank you so much. It's lovely to be here. If I may start by sharing my screen and bringing my slides up. I hope my slide is visible.
Yes, sir.
Thank you. So we're going to talk about autism and neurodiversity and how we can think about unlocking human potential. I hope this presentation will open up some new thoughts and ideas for all those who've joined us today. We'll start by getting the basics right, understanding autism and neurodiversity, a little bit about multiple intelligences and thinking different, and then, of course, how do you unlock human potential? So just the basics. What is learning? The learning, of course, is acquisition of new or modification of existing knowledge, behavior, skills, values, or preferences. And this is something that all of us are familiar with. Memory, on the other hand, is a process by which information is encoded, stored, and retrieved. And of course, when I am talking to you, for example, you register or encode information first. You then create a storage. Now, if I'm giving you a telephone number, that may be a temporary storage. If it's something which you find is important or critical to you, that may be even long-term storage. And then, of course, you retrieve, recall, or recollect. And the more you rehearse, the better your memory is. And that, of course, is something that unrehearsed information is less well remembered than well-rehearsed information. And this is something that all of us need to think about. This is just a graphic to tell you that there's so much to memory. It's not just one thing. And if you think about it, there are facts that we remember. They may not be relevant to us at any particular time, but we have a whole storehouse of information in our heads. There are things that we remember how to do. We remember how to swim. We remember how to drive. We remember how to cycle. We learn these skills. And when we are doing them, we are not necessarily having to think every moment of the way. And that also is an aspect of your memory. And then, of course, you use your memory to communicate. Your memory has cultural elements. Your memory is influenced by your emotions. There is so much to memory. And this graphic just reminds you of that. And then, of course, what is behavior? It's the response of the organism or indeed the system, because a system can react as well to various stimuli or inputs. And those inputs can be internal or external. They can be conscious or subconscious. They can be overt or covert. They can be voluntary or involuntary. In sum, behavior is how we respond to various stimuli. Now, human behavior, of course, can be common. It can be unusual. It can be acceptable or unacceptable. And of course, we use social norms in order to evaluate the acceptability of behavior. For people with neurodiversity, and this is something that is the subject of today's discussion, they could have problems in behavior which result both because their expectations don't necessarily match social norms, or indeed the other way around, that what people are expecting from them is not what they are able to deliver. And this is something that one has to understand, that the gap really is between what we are expecting and what the person is able to do or willing to do. And we need to keep focus on this. Now,
can I just interrupt for a second? Some participant has sent a message saying the screen is blank, but I can see the screen. So I just wanted to check with the Hindu team whether it's okay, because there's a message from one of the members in the audience.
It might be an individual problem, and the one thing they might want to do is leave and join again.
Yeah.
That often helps with Zoom.
Okay. Sorry, sir. Sorry for the interruption.
So we'll continue.
Yeah. Yes.
So when you're thinking about a problem, or a perceived problem, either in yourself or somebody you need to ask yourself, is it a problem of learning? Is it a problem of memory? Is it a problem of behavior? You also need to ask yourself, is it developmental, as in it's been there from very early on in life, or is it acquired? Is it something that came on later at a particular point that you're able to figure out? And then, of course, it could be psychological, it could be psychosocial. Psychological is based on your psyche, how you've internalized your life experiences. Psychosocial is more your environment, or it could really be from your brain. It could be neuropsychiatric. And therefore, it's very important to try and understand which of these it is, because the way we address a problem is going to very much depend on this understanding. And of course, you may not, as an individual, have the capacity to understand this, which is why you have specialists, doctors and psychologists and others who can actually help with this process. Now, there's another important word here, which is aptitude. We all have innate potential to do certain things. We all lack the innate potential to do certain things. And obviously, in academic environments, we often use aptitude to predict learning or performance. Aptitude is not just inherent, it can be developed through focused long-term instruction. So you can actually develop an aptitude for something if you're working on it with people who are capable of helping you work on it. But in general, what comes to you easily and naturally, your innate potential, that is probably the most important part of your aptitude, which then serves you well when you choose courses, when you choose careers. And if you choose something that is not something that you have an inherent capacity for or an inherent aptitude for, you do less well than when you choose something for which you do actually have an inherent aptitude for. Now we come to this whole concept of neurodiversity. And as you were saying earlier, it describes the idea that people experience and interact with the world in different ways. And there's really no one right way of doing it. As a term, it was coined by an Australian sociologist in the early 1990s, and there was a whole movement that came with it, which was all about getting people to embrace neurological differences and help people with neurological differences be part of our society and communities. That really was the movement. And of course, as you were pointing out, autism spectrum disorder, attention deficit and hyperactivity disorder, and various other neurodevelopmental conditions, they form the core of most neurodiverse populations. But you can be neurodiverse without having a very, what shall I say, obvious manifestation of any of those conditions. And that is also something that we are focusing on today in this presentation. Now, what is autism? We just crossed the International Month for Awareness of Autism, which is April. Basically, it's a problem with language development, communication, socialization, and emotional expression. People in the spectrum find these things rather difficult, and that is where there is a gap between them and the rest of the population. Both the people who described autism in the 1930s quite independently, Kanner and Asperger, one in the US and one in Europe, said the same thing, that there was a need for sameness. The person preferred to do certain things over and over again. The person preferred similar environments, similar ways of doing things, similar activities, and a certain predictability is how they described it. Many people with autism have sensory issues. They can be hypersensitive to things like sounds and colors. They may close their ears when there are loud sounds or behave abnormally when there are sudden sensory stimuli of that nature. They may prefer to wear only certain types of clothing, eat only certain types of food. Texture, for example, is very important for them. And they may only tolerate certain environments and reject others. And of course, they may communicate inappropriately, either by avoiding or seeking excessively certain environmental stimuli, touch, play, pain, closeness, and so on. Now, the important thing to remember here is that when a person has very strong manifestations, they get noticed very early, they are visible to us, and very rarely does a person go undiagnosed, although that can still happen. But there are many people out there with less prominent manifestations, but those manifestations exist, those manifestations do influence their lives, and that's what makes them neurodiverse. That's what makes it difficult for them to adapt themselves into societies and communities, into educational environments, and so on. And that's part of the awareness that we are trying to seek. And of course, there are people with ADHD who are impulsive, loud, and emotionally volatile. That's a form of neurodiversity. With chronic temporal lobe epilepsy, we have what's called the Geschwind syndrome, hyperreligiosity, hypergraphia, a tendency to write excessively without being exactly creative, and hyposexuality. There are people, for example, with certain conditions like borderline personality disorder who need to feel pain in order to obtain relief from stress. So they hurt themselves repeatedly. That also is a form of diversity. It's a different way of dealing with your problems. And therefore, on the whole, if you think about it, we live in a society where we've created round holes into which we expect people to fit. And those round holes are our family environments and our expectations, our educational environments and our expectations, our work environments and our expectations of what marriage should be like and how a person should function within the institution of marriage. So those are round holes. And then this person who's neurodiverse is, of course, a square peg who doesn't necessarily fit into the round hole and is constantly, therefore, in some way, either perceived to be underperforming or is made to feel a misfit. And this has got nothing to do with intelligence, because we have, for example, kids approaching genius level, very, very high IQ. We even call them gifted. They often find it very difficult to fit into their educational work environments. In fact, ever so often, I find myself meeting one of these children and telling the parents, the problem is not that your child is not intelligent. The problem is your child is way too smart and is not able to fit in to that regular school environment in which he or she is in. So the one thing we all need to be aware of is that we've created an ordinary world and it does not have space for the extraordinary. And the easiest thing for us to do is to reject the extraordinary. And we do know this, of course. Institutional politics is the best example of how people who are really good get rejected. But, you don't have to be, just neurodiverse, but there are other reasons why that happens. Now, when does it become really apparent? And today, I meet a lot of young people who've actually managed to go through education in school and college. But it's when they reach college or when they've started doing their postgraduate degree or they started working for the first time, when their self-awareness becomes greater, when they are more aware of their own individuality, when they find difficulties into fitting into environments, that is when they do realize that perhaps I may be neurodiverse. And of course, this can create a lot of mental health problems because there's a whole journey of feeling less confident about yourself, a whole journey of feeling rejected, a whole journey of feeling a misfit before you get to the point where you kind of start thinking, maybe this has got, not just about me, it's the way I am, and it's about how where I am is accepting me. So there is this whole journey to self-acceptance that becomes extremely necessary. So recognition becomes very important in order to put the person on the journey towards self-acceptance. So how can you assess? And we work with people across the lifespan. There is detailed cognitive and behavioral profiling that is necessary. The best people to do this are psychiatrists and psychologists with the appropriate training. And it's never too late. In fact, we just helped a gentleman in his 50s with a good track record working in tech. He presented to us with mental health symptoms. And as we worked with him, we realized that he was in the spectrum and high functioning. And he didn't know that. And when he learned that, it actually helped him so much because it took away years of guilt and self-blame and feeling of failure. as to why he could not do certain things despite being smart, despite being, what shall I say, very capable in the work that he did. And I think this is, it's so critical, therefore, that we help people understand. And the most important message is that meeting a psychiatrist or a psychologist with appropriate training would be one way in which you can actually get yourself diagnosed. Now, how do you deal with it? And the most important message, there's a Harvard Medical School blog on this subject. It talks about understanding the preferred language. How are you going to refer to the person? So, for example, there's a whole movement to say people with epilepsy, people with autism, people with ADHD, and not use words like epileptic and autistic. But equally, if you ask people who have the condition, they may think differently, is what the blog points out. So it's very important to understand what the preferred language is. It's very important to understand and acknowledge. And what we find very often is that we have youngsters who say, Doc, I think I may be on the spectrum. I want to get diagnosed. They are eager to go through the process, but their families don't necessarily buy into that. And sometimes the impediment becomes getting somebody else in the environment to sort of accept and agree that this person may have a problem. We have to work with people and their families to inform, educate. And equally, if you're in school or in university, it's very, very important that the people you work with there are also informed and educated about what you might do well and what you may not do well and why. In the UK, for example, there's this whole process called statementing, where the medical team and the educational institution together draw up a statement of unique needs for the individual so that you're able to address their problems well. Sometimes, even with all the counseling, all the support, all the awareness building, a person cannot adapt into the environment because of the square peg round hole situation. And there, seeking alternative institutions or finding alternative methods of engagement is extremely important. And we do have a number of youngsters, for example, who go into homeschooling with the support of their families, or indeed go into something like the NIOS system, or indeed, when they are very young, shift into the Montessori education system, which is much more welcoming for this type of situation. So, in a sense, sometimes you need to change the situation, but in many instances, we are actually able to work with people to help improve things. If you yourself run an organization, an education institution, or you're responsible in a place that has neurodiverse individuals, it's very important that we are sensitive to their needs. You have to make adjustments for sound, light, tactile sensitivity, allow them breaks, allow them devices like noise cancelling, headphones, flexible seating, all this. Communicate clearly. They don't really understand euphemisms, sarcasm, implied messages, and so on. So very clear instructions, things which are written down, these things help a lot. Predictability helps a lot. And being respectful of individual needs and capabilities is extremely important, allowing the person to demonstrate their talents in your environment. These things are extremely important as well. Just to give you a little aside, if you watch Big Bang Theory, think Sheldon. Sheldon's your classic example of being neurodiverse. So in a sense, he sits in the same place on Friday, the same place in the sofa, he eats the same kind of meal, and he gets very upset if the takeout is not Chinese or if somebody else has occupied his place on the sofa. That's a caricature of the problem, but I'd like you as the audience to understand, but that's the nature of the problem as well, that I like to do. That need for sameness comes in for a lot of people. Now, I'd like to bring up this concept of multiple intelligences because it's a very good way of working with people who are diverse. I must say that Buddhi Clinic has benefited greatly through our advisor, Mrs. Usha Ramakrishnan, who's a well-known educational psychologist who's made us adapt these thought processes and values. Now, what Howard Gardner, who's a famous Harvard psychologist, said is that it's not how smart you are, it's how you're smart. And he identified various types of intelligence, which really are areas of interest. So it could be spatial, for example, seeing and mapping the world in 3D in your head. It could be musical, the capacity to recognize, create, reproduce, and reflect on music. It could be logical reasoning. You're skilled at deductive reasoning, detecting patterns, and logical thinking. It could be interpersonal, communicating and reading people and getting on with them. It could be bodily kinesthetic, using one's body in a coordinated way, for example, for dance, or indeed for sport or for martial arts and so on. It could be linguistic, in this, mastering the spoken or the written language. It could be intrapersonal. It could a good understanding of yourself, how you feel, and so on. And it could be naturalistic, understanding nature and organic processes. Now, the thing to keep in mind that all of us probably have three of these. And the most important thing to also remember when we are doing those things, A, we enjoy what we are doing. B, we inherently are equipped to do them well. And this is important to keep in mind. So when we talk about what should people who are neurodiverse do, this becomes extremely important. So in development and community, if you look at it, people automatically veer towards fields where they have a high intelligence. The local culture is important. When there is an opportunity to develop your intelligence in your local culture, that becomes very, very important. And society is important when society starts recognizing the person's competence, and awards and recognizes that competence, then obviously the intelligence develops to the next level. So if you think about career and fields, people who are visual spatial, for example, are better equipped to be designers and engineers, musical, singer, composer of music, and so on. Interpersonal, often leaders, social workers. Intrapersonal, people who are philosophical, people who enter the clergy, and so on. Logical, bankers, accountants. There's a fair amount of logic in law as well. Medicine's got a huge balance of logic built into it as well. Kinesthetic, actors, athletes, and naturalistic is biologists, conservationists, farmers, linguistic, poets, writers. So in a sense, if you understand which of these come quite naturally to you, and we've made this now a part of the way we assess people, because we can then use this to help them express themselves and understand better as well. I'll give you a very simple example. A kid who's, say, for example, a very visual learner, rather than expect the child to always read a book and understand, if you're able to sit down with the child and take the child through an exercise, for example, of watching a YouTube on the subject, which is available in plenty today, the child probably understands much better. And that makes a huge difference. So being able to recognize the proclivities of the individual and then giving them an opportunity to experience and expand their skill sets in those proclivities is so important, is something that we have to keep in mind. What are the other brain factors that play a role? And this, of course, is the huge left and right brain hemispheric dominance hypothesis, which is not really popular these days, but still has a lot of value in the way we understand people. Basically, that your right hemisphere is the emotionally dominant hemisphere, and the left hemisphere tends to be more logical. There's also something called the valence hypothesis, where your left hemisphere has more positive and the right hemisphere more negative emotions. I wrote this article in the Hindu magazine years ago. Let me introduce you to Carlo, our German Shepherd, and Coco, our Basset Hound, both late and beloved now. But they taught me so much about brain dominance in the morning walk. This is still available on the Hindu archive, so I'd encourage you to go and read it. But effectively, in that article, I concluded as such. I said left brain dominant individuals tend to be more ideological and philosophical in their approach, more motivated by social and pragmatic rather than emotional concerns, more diligent, purposeful, capable of greater tenacity, and driven more often by a sense of duty. And right brain dominant people have a better appreciation of the world around them, greater creative ability, a proclivity for the finer aspects of life, tend to be more mood and emotion driven in making their choices, both day-to-day ones and those that are life-defining. I also relied a lot on the epilepsy literature, which talks about left-sided temporal lobe epilepsy and right-sided temporal lobe epilepsy and personality and behavior to make these propositions. So they come from that basis as well. Most importantly, I think one of the things that I ended that article with was by saying, choose your activity companions wisely. Choose your left brain companions for purposeful activity and right brain companions for hedonistic activity. And if you did that, then you wouldn't be so disappointed with what is going on around you. Was something. So I invite people to sort of Google this article and read it. It's available in the archives. I also wrote this piece on brain dominance as a guide to choosing life and career. And I, again, why not allow young people to make the choices their brains are dominant for is the question I ended it with. Again, what I'm trying to say, therefore, is that your brain has a role to play in the way you're wired and how you express yourself, what you're good at and what you're not good at, what comes naturally to you, what challenges you. And let's be very honest, all of us have those things. The biggest problem is we expect everybody to fit into this round hole called society that we've created. And I think that's something we need to be acutely aware of, because there are people out there who don't fit into that round hole. Now, these are some of the assessments that we can use. We just highlighted a few, but the point I want to make is that today excellent assessments are available online, and we are able to do assessments for people who are not able to come to clinic as well, or who live in a different city from us. Makes all the difference. But there are standard tools like the Childhood Autism Rating Scale or the Adult ADHD Scale that are used as part of assessments. I think, what do you expect as part of assessment? You want a scientific deep dive into your brain and mind, and you want to know at the end of that deep dive what exactly your problems are and how you performed in various tests. And I think that, once again, going to well-trained, competent professionals is what everyone should consider. Well-trained psychiatrists, well-trained psychologists, and particularly for assessments like this, clinical psychologists, people who've got an MPhil or a PhD from an institute which is recognized, are the people who can actually do this well for you. And we have a range of tools available today. The tools are not the problem. We just have to make ourselves available and engage with them. Just a few solutions. What can you do if you do have some problems, not just neurodiversity, but problems which make it difficult for you to cope, because you're challenged by learning, you're challenged by memory, you're challenged by behavior, your mental health is challenged, then what can we do? Now we have a whole toolbox of brain stimulation techniques, and this is a growing toolbox. There are new things that come up quite regularly now. It's a very exciting space to be in. At Buddhi Clinic, we offer TMS, which is using magnetic pulses to stimulate specific brain regions. TDCS, which uses weak electrical currents to modulate brain activity. If you listen to the introduction, you would have heard Vivek say that also has alternate current and random noise and various other protocols. Transcutaneous auricular vagus nerve stimulation, which influences mood and stress regulation. It's good for epilepsy control, migraine management, a range of other comorbidities that people often suffer with. Neurofeedback, which I'll talk about a little bit, it trains the brain to self-regulate your activity. It's a very good way of improving your potential. And FMS, which is used in conditions where your nerve muscle groups are affected, for example, cerebral palsy, which was mentioned early on in this program. QEEG guided neurofeedback monitors your brain for brainwave activity and provides immediate feedback, visual or audio cues. And by controlling the computer using this cap that you see the young man using, what you are able to do is to overcome some of the difficulties that you are facing because of your ADHD or because of anxiety or depression and so on. So this is something that is to be considered. And then, of course, we have this treatment called TDCS, which I mentioned. What it does is it refines the neurotransmitter balance, it changes cortical excitability, it decreases inhibitory neurotransmitter release, it improves cognitive performance, and you can see how it can be personalized. We have this child who's got the TDCS going and at the same time is engaging in occupational activity that is meant to train the brain. And we've seen this enhance. So stimulating the brain while you do speech therapy, while you do occupational therapy, while you do psychological therapy actually has a very positive effect on the individual. There's this whole field called neuroergonomics, very important for people with neurodiversity. It's just a way of thinking. We used to attribute a lot of our problems to psychological and psychosocial reasons. What we have recognized through research and years of science is that a lot of it is due to your brain. It's your neuroscience. And understanding your neuroscience and being able to hack into it to perform better is really what this whole field is all about. And thanks to the development of modern technology, some of the things that I've talked to you about today, this is a reality today. It's not just something that is imaginary. So in summary, it's not just okay to be different. It's good to be different. It's not just whether you are smart. It is how you're smart. Rather than fight every difference and attempt to change how the person functions, it's better we focus on how they are smart. We optimize how they perform. We use this to help them develop an identity. And we use this to help them diminish other negative influences around them, both behavioral and psychosocial. There's a lot of potential here. We've heard of Albert Einstein reportedly being neurodiverse. We've heard of Bill Gates being neurodiverse, but we now have Elon Musk openly telling us that, yes, I am neurodiverse. So it's no longer something to be worried about or ashamed of. It is something to embrace. And really, as a society, as people in a society who are responsible, we should think about creating spaces for extraordinary people to thrive. And I think that's the positivism that I'd like to see come into this space. With this, I'll say thank you very much. It's been great talking. I'm very happy to take questions. Thank you.
Thank you so much, Doctor, for that wonderful explainer. And it was really fascinating indeed to learn about neurodiversity. And there are a lot of questions. I think we'll dive into them right away. Just quickly, I just wanted to say that, I've hosted a lot of health webinars, and in every webinar, the panelists will always mention that there is there's a lack of awareness about the topics we discuss. And you very specifically mentioned that in your clinical practice, you come across lots and lots of young people who choose to identify themselves as neurodiverse. So does that mean that, you did mention briefly that people read up a lot of things and all, but there is really an awareness and then people really come forward for treatment?
I guess the thing to remember is that, of course, awareness is the privilege of a select few.
Yeah.
And, when whom you meet, who's declaring that when they come is obviously the tip of the iceberg. I'm sure there are a lot of people out there who are not as aware, either through knowledge or through self-awareness. And that's one thing. But I think it's increasingly we live in a world. I'm very optimistic about the young population. I think they are very, very intuitive, and they're very, they are also empowered by being able to look for information and then use it to their advantage. So I guess that, I'm very happy to see young people come forward if in doubt. And I think I want young people to come forward and ask this question to people they may consult if in doubt, because I think that's really important.
And maybe it might sound a little silly, but after listening to all the points, the thought which came to my mind was, like when you talked on your slide about this realization or things that come to you naturally, things that you're comfortable in doing with, this kind of realization is many times delayed in especially youngsters, since we are focusing. So, and we normally think that is normal. I mean, some people take 2 years to realize, some people take 10 years to realize. But then if we identify it like the way you have categorized, the points, then, I mean, then who's normal? Then I think everybody comes under the neurodiverse spectrum. How would you kind of...
Uh, Absolutely right. There's a little bit of neurodiversity in all of us. Okay.
Yes.
So there's a childhood friend who lives abroad who pointed out to me the other day, you only wear white. Are you not neurodiverse? So in a sense, quite honestly speaking, there's a bit of it in every one of us. We have our pet peeves. There are things we are uncomfortable doing. And the thing to remember, however, I think it's to accept that we are all wired in a certain way and to embrace those differences and not be uncomfortable about certain things about us. If they are different, that's okay. We just need to embrace those differences, not beat ourselves up for them.
Right. So you mentioned Big Bang Theory, so I'll just take one little similar question. Sunil Kumar is asking, how accurate is the movie Rain Man in depiction? And have there been any mentions in the ancient Indian texts or any other in Eastern culture regarding
Okay.
neurodiversity?
The answer to the latter question is I don't know. The answer to Rain Man is that, I think movies are caricatures of problems in society. So obviously, both the Big Bang Theory and Rain Man are hugely exaggerated in a certain way, but they are meant to make you aware and understand how a problem can be so intense for a person. But Rain Man is a perfect example of someone with high functioning autism spectrum disorder who is so clever in certain ways, but yet, for example, has to travel to a Kmart 300 miles behind in order to buy underwear, because that's where mom always bought it for me. So, it's a very good example of that as well.
Rathi is asking a very basic question. Does a brain scan actually reveal the autistic condition?
Okay, so I think the nuance to this is if you do a standard cross-sectional at a time scan, like an MRI, it will not reveal anything. What researchers have done, and this is not part of clinical practice, what researchers have done are serial MRI scans where they have either a strong family history or a genetic loading, or indeed they pick up the signs early. Those show changes. Those, for example, one of the things that has been described is overgrowth of certain brain regions at the expense of others, which also explains to some extent why a person may be extremely or exceptionally good at one thing. But, for example, I can do the square root of whatever you give me, but I can't tie my shoelaces. So in a sense, that explains that. But to answer her question, I think we don't do these scans as diagnostics. No. A scan only rules out if there's any other cause for the problem which has gone undiagnosed.
Right. Hara Gopal wants to know, is there some way to know how much of memory resources are assigned to various sensory inputs like visual, auditory, tactile? And is there any hierarchy of importance? And if there is such a hierarchy, then could a skewed allocation of memory resources be one of the causes of autism?
All right. So I think it's very hard to separate out and understand how much memory resources are allocated. The thing about memory itself is we learned this through something called the London cab driver study. So we're all familiar with the black cabs in London. They are unique. And to drive a black cab, you have to pass a test called the knowledge. And of course, in the days before Google Maps and such, this involved learning to remember the entire London map in your head by heart. Okay. Including, for example, the test would say, how would you go from Smith Street in W6 to, say, Luton Street in S1 or whatever? And you'll have to say everything, including every one way and so on. You had to remember this. Now, what they did at University College London is a very famous old study now, was they looked at the size of the hippocampus, which is a small structure. If you draw a line between your ears, it's a small structure the size of a finger joint. They looked at its size before these guys started learning this whole London map thing. And it's a 2-year program. So they serially examined the size and they found it actually increased in size. So this study was one of the earliest studies to show us that the brain was a plastic organ. It was capable of change, and what you did brought about that change. Now, I'm saying this to say, rather than thinking of it as resource allocation, it may be how you train your brain to do things better and better and better. And if you think about it, anyone who's skilled in anything particular gets better and better at it because they are constantly using those brain pathways, to do this. I forgot the last question. He had 3 questions. The third one was?
Okay. Is there a correlation between, no, not this one. He said if there is a hierarchy, then could a skewed allocation of memory resources be one of the causes of autism?
So I don't know if it is a skewed allocation of memory resources in particular, but from whatever research has come out, it's probably a skewed allocation of neural resources. So when I pointed out the example of somebody who can do the square root of anything in seconds, but can't tie their own shoelaces, that's what I mean. So there is that skewed allocation of neural resources is probably not an unfair statement to make.
And is there a correlation between autism and a tendency to do self-harm?
Not necessarily, although people with autism can have sensory issues, as can have people with many other, conditions. And when you have sensory issues, the need to feel pain could be one of those sensory issues, and that causes self-harm. It could also become a behavioral response to being uncomfortable or being challenged. In certain ways. So you're made to do something that you hate doing. It causes you a lot of anxiety and agitation, and then the self-harm becomes a response. It could be like that, but it's not typical of autism per se. No. A person with autism can self-harm in particular ways. Like, for example, just to qualify that, okay, I have children who have to touch something that's hot, and they have to touch it really hard. So they will get a little scalded in the process. They have to touch something sharp, and they'll have to really press on it to feel how sharp it is. That, yes, but it's not self-harm as it is we see in other people with mental health conditions. It's not the same thing, no.
Right. Doraiswamy Ramaswamy has a question on Parkinson's disease. He's asking whether it can be cured completely, and also because he saw a video from Nanavati Hospital where dopamine hormone is injected, as it's supposed to be one of the latest and permanent. That's what he wants to know. And he's also asking whether there's an alternate to cure or arrest Parkinson's, because he saw in your pamphlet where you have included Parkinson in your treatment. So he wants you to throw some light on that.
Sure. So the first answer is the Nanavati video has been discredited by a lot of people in the medical profession. That particular treatment is for a particular type of person. It's an emergency treatment and it's not permanent. It helps them at that time. So it's the injection of apomorphine that we are talking about. So it's for people who have severe freezing, cannot move, and they actually are in a crisis. It's a very specific situation. To answer the question about Parkinson's itself, Parkinson's is a progressive neurodegenerative disorder. So there is today no permanent cure for it. All our treatments mitigate symptoms. The most mainstay of treatment are medicines. We have drugs that increase the amount of dopamine in the brain. They're called pro-dopaminergic agents. They're called agonists. The dopamine you already have goes up when you take them. We have levodopa, which is a synthetic analog. So you're replacing dopamine by taking levodopa. So in a sense, when you're taking an agonist, you are rainwater harvesting. When you're taking the synthetic analog, you're buying water. So you'd rather harvest than buy water is the obvious logic. There are a number of non-drug treatments available today. We have brain stimulation procedures. There are 2 ways this can be done. There is invasive brain stimulation, where you have a surgery to put an implant a stimulator into your brain. One needs to be a suitable candidate for that. Then there is non-invasive brain stimulation using transcranial magnetic stimulation, which I talked about, where the stimulation comes from the outside. And the one thing these brain stimulation procedures are good at is that they reduce tremors, which is very difficult to treat with drugs. So that's the short answer to Parkinson's.
Mm-hmm. Sunil Kumar says, how can we straitjacket individuals and categorize them? Because conformance may also alter their perceptions and consequently their performance.
I guess that's exactly what we are trying to talk about in the other way.
Yes.
I would say this, that if you don't diagnose, you can't help. And if you don't know, you can't seek help. So, in a sense, I think one shouldn't think about it as labeling or straitjacketing. One should think about it as self-knowledge and self-awareness. That I need to understand myself, especially if I'm finding difficulties. I mean, if your life is hunky-dory and nothing is a problem, then this doesn't apply. But if you are finding difficulties, whatever age and stage of life, then obviously knowing what's causing those difficulties is important. And once you know that, then you can do something about it. And as I've tried to say in this talk, the possibilities today are enormous. There's so much that one can do. So I think the knowing becomes very important.
Rajshekharan wants you to quickly once more reiterate on the difference between psychological, psychosocial, and neuropsychiatric.
Okay. The psyche, as we understand it, is your mind as a product of life experience. We all have positive experiences. We all have negative experiences. Positive experiences give us affirmations. They strengthen us. Negative experiences leave us with scars. So our psyche is a dynamic state of mind, which evolves as we go through life. So things can trigger your psyche to respond in a certain way. So for example, a traumatic memory can be a very important trigger. For example, people who've gone through unspeakable horrors when they were very young, abuse, for example, or people who have had a huge incident that traumatized them, what we call post-traumatic stress disorder, for example. In all these circumstances, the psyche itself has hidden triggers, which then come out when that trigger is exposed. On the other hand, psychosocial is very much to do with my environment. What is my work-life balance like? What is my family like? What are my support systems like? What are my economic circumstances like? And are any of these things triggering me? And that's the big difference.
So then when you mentioned also developmental conditions, like somebody has undergone some very traumatic brain surgery, or somebody has, is really facing a lot of ups and downs, businesses down, financial loss. So those kind of events in life can also trigger change.
Yes. So in a sense, if you think about it, the substrate on which your mind operates is your brain. So anything that's affected your brain, either developmentally, as in that there is a problem of brain development that you had, or you had seizures, whatever, and indeed something that you acquired, like for example, a head injury. Say you're riding a bike when you were 18 and you had a head injury. Now, all these things can obviously influence your mind, because once the substrate is disturbed, then obviously, what relies on it does face disturbance as well. And that's probably the way to think about it.
So if there is a delay in identifying or accepting or acknowledging neurodiversity, and after that, if all behavioral therapies fail, then does that make a neurodiverse individual extremely aggressive? Suresh Kumar Raja is asking.
Yes. So I think the way to think about this, therefore, when anything like this goes unrecognized, and you're treating the symptoms but not the cause, obviously your ability to help the person is limited, because you're muting symptoms without addressing the cause. And I think if neurodiversity is the cause of mental health issues, then addressing the neurodiversity itself, for example, I'm on the autism spectrum, or I have unrecognized silent seizures in my head, whatever. Addressing that is very important if you're going to help me with my mental health. Otherwise, anything you do for my mental health is like a band-aid. It's not addressing the core. So the answer is to know the core, because then you can address the core.
Sangeeta Sriram is a 48-year-old female living in Oroville, going through a severe burnout and an assessment for neurodivergence. She says it is recognized that most research is done using males, children or adult, while ASD manifests differently in females. For example, better eye contact, better socialization. And so she wants to know, how much do you work with ND females, and do you have any kind of brain imaging that confirms ASD?
Okay, so I'll answer the brain imaging question first. No, there is no specific brain imaging to confirm this. It is a whole range of psychological and neuroscientific tests that will help us conclude what causes the ASD in that individual, what are the manifestations, and so on, and how we can help. To answer the question on women and men, yes, it's much better and much more easily recognized in men than in women. She's absolutely right. And yes, because of certain social factors where, the things she mentioned, women do those things better, it can get missed. Yes. And I do have women who come and tell me that, Doc, I think I'm neurodivergent. So, people do self-recognize, and when they do, rather than brush it off, whoever they're consulting should help them kind of deep dive into it and understand it a little better. You could be wrong. I mean, this is very important to recognize that also, one could be wrong in that suspicion, but knowing more about that suspicion and validating it one way or the other is extremely important.
Right.
Yes.
So Juve is asking about the role of food, the diet in modifying neurodivergent behavior.
Right. So there is obviously some literature, both in autism and in epilepsy, of specific diets being helpful. Okay. So this is the gluten-free, casein-free diet or the ketogenic diet. These things are published and talked about. They don't work for everyone. They work for a proportion of people with autism. They work for the proportion of children with epilepsy. Ketogenic diet works best only for a proportion again. So knowing whether you belong to the proportion is extremely important. And I don't believe there is a test that tells us at this point in time whether you actually fall into that proportion of people. This is one. On the other hand, I think I also pointed out that people, for example, in the spectrum, can only eat certain foods, certain textures of foods, and so on. And of course, their diet gets compromised. This is something to remember. There is definitely a role for holistic care. So we work with a lot of children and youngsters. Now I'm talking about autism spectrum being frankly expressed, where it is clearly diagnosed and it's moderate to severe autism, for example. We see a huge advantage in holistic therapies for them. There are many youngsters who get better just with simple Ayurveda naturopathy techniques, which can be practiced. We do a course. We now have a whole online way of doing it. We have an app that helps people do this themselves at home. And it does help people maintain better. Very strong comorbidity in autism is constipation or having bowel disturbances. It often goes with the peculiarities of eating as well. So that's something to be kept in mind. And yes, there is a role for diet. There is a role for natural methods of healing.
So what about senior citizens? Because they kind of a partial memory loss or not being able to remember is also considered normal. But then, how would you kind of assess that?
So I think it's very important to keep this in mind. Yes, there is something called senescence, where there's a certain amount of normal forgetting that happens. The brain does change as we get older. One classic example, let's say, somebody like you or I, middle-aged, and an older person are both heading to the airport, and we reach late and the flight has left. The older person is more likely to be frozen and panicked than look for alternatives. The younger person will look for alternatives, and it is a youngster who very easily look for alternatives. So in a sense, there are things that change about you as you get older, which are quite normal. Having said that, memory loss beyond a certain point is never normal. And we do have this whole spectrum of what's called mild cognitive impairment, where people have problems with recent memory, clear problems with recent memory. They're good with older things, and they retain their ability to do simple activities of daily living, but start finding complex activities of daily living difficult. So MCI is something to be diagnosed, tested for and diagnosed. And yes, pretty much a number of the technologies we talked about, the number of the rehabilitative therapies we talked about, the holistic care we talked about, all this can be extremely helpful for the older person with forgetfulness, early dementia or mild cognitive impairment, can be helpful in Parkinson's, it can be helpful after a stroke. So there is definitely scope to help.
Mm. Bhargavi is asking that people with neurodiversity, are they more prone to any kind of addiction to substances or gadgets or any other forms to stimulate their brain more?
Spot on. Yes, because these become coping mechanisms. If you're undiagnosed, you're struggling, then obviously substance use, which is a way of calming down, gadget use, which is a way of compensating, all these things definitely become a problem or reach problematic levels in many youngsters. And sometimes that's the other thing, that you need to look beyond the problem to understand what's causing it. I was talking about, when there's a mental health presentation, just treating the presentation is sometimes just a band-aid. There is something underlying it, and what can be underlying it is neurodiversity in some individuals, because that's what's preventing them from fitting in into whatever they're trying to do, whether it's school or college or higher order work and so on.
So Yuvarajan Sankaran wants to know, is autism congenital or it can develop later?
So most people seem to present with their autism spectrum, in the autism spectrum, with the symptoms between the ages of 2 and 5. Most people seem to. It's not present when you're born. In fact, very often, many of the parents I meet say, oh, my child was fine, even had started speaking by the time she was 2, and then suddenly everything changed. So it's not developmental as in present from birth or congenital as in present from birth, but it is a problem of early development because your brain is still developing at that stage. So it is a problem of early brain development. And of course, it then continues through a good part of one's life.
So there are lots and lots of questions and very, very specific questions. Everybody's citing their son's case, spouse case. So I think we're also running out of time. Maybe you could answer them individually and directly respond to their questions. But I will just round up with one final question, which is always, the dominant in our minds, like what happens to parents with children with neurodiversity? I mean, somebody's asking actually, are there any rehabilitation options available? Because every parent is worried, what happens after I go? So if you could just throw some light on that.
Certainly. Before I answer that, if people want to ask a question, please email care, C-A-R-E, at buddhiclinic.com. I'll just request somebody from Buddhi Clinic to put that into the chat as well. It's care at buddhiclinic.com. Just email us and we'll definitely do our best to answer each person's query.
Yeah, there are about 24 of those very specific questions, which I'm not taking one by one.
Absolutely. So very, very happy and privileged to answer those questions. And we thank you for being here today with us. With regard to your question about what happens after me, yes, you're absolutely right. It's predominant in people's minds. If I looked at it personally, what I would say, the first thing to do, obviously, is to understand the problem well enough, not to look at it as a problem, but to look at what solutions are inherent within it. So in as much as there is incapability, there's also capability. So identify the capability, and this whole idea of multiple intelligences that I talked about is one very nice way of identifying capability. Enhance capability, work to enhance capability, because we've had kids become accomplished painters, accomplished musicians, accomplished writers. There's someone who we worked with who's also already published a few books. So in a sense, helping them identify their potential, helping them express that potential is something that we can do as parents. And we need to walk that distance with them, find the potential and help them express that potential. What that does, it makes my activity more purposeful. It gives me identity, and all of us as human beings need identity. It gives me validation, because all of us need validation. Otherwise, it's very hard to sort of go on and on without validation. If you've done those things, then there are practical things that you have to do. Those include, for example, self-help skills, teaching the person how they can live with limited support, teaching them basic survival skills and concepts, and you may not always succeed. It's something to understand that depending on the level of problem the child or the person has, you may not be able to do all these things, but do them to the best of your ability. There are rehabilitation facilities that will help you. You'll need to look for them. You need to find one that is kosher. That's very important. There are, as I pointed out, a range of approaches that can help people. And reaching out for those approaches is extremely important as well. And I think also, you can't afford to give up. You also need to think smart, as in, how can I protect my youngster? So, for example, setting up something like a trust fund, making resources available to them which are well protected is extremely important. These things families have to think about early. Talk to their lawyers, talk to their accountants. Today, there is a very strong Disability Act. It makes provisions for all this. The state is today responsible for you if you are registered disabled. That is established in India. The state cannot get away from its own responsibilities, very well and clearly established. So knowing that, knowing how to appoint guardians, there's a very clear system of guardianship today. All this is very well established today. So knowing those laws and making sure you optimize and implement them for the benefit of your youngster is something that I would encourage all families to consider when they have someone who has difficulty in caring for themselves.
Thank you so much, sir. I mean, we would have loved to continue this discussion, but there's a time limit. And I think I can very well wrap up the session by saying that neurodiversity is actually a superpower and not a problem. There's nothing wrong or bad in being neurodiverse, and to normalize neurodiversity, that acceptance that everybody is different has to come. So I thank you, Dr. Krishnamurthy, for sparing your time and so beautifully explaining the subject to us. And I would also like to thank all those who joined today's conversation and sent in their questions. This webinar on autism and neurodiversity was presented by the Buddhi Clinic Chennai under the Hindu Wellness series. Thank you so much.
Thank you.
Thank you, sir.